So a lot of times people get numbness or tingling in their hands and they want to know what is this and how we can treat it. There's a lot of different things that can cause it, but essentially if you're having numbness and tingling in your hands, that means there's a problem with the nerve signal. It's getting pinched somewhere here. So it could be a nerve issue, it could be a brain issue, it could be something else. But often in our situation, it's a neuromusculoskeletal issue. What that means is there's something in there that's pinching a nerve down that path. So what we want to do in our office is be a little more thorough than the average office. So I'm going to explain like what we do and how we're going to treat that today. So when we take a look at the nerves that go down to the arm, they're going to come out of the spine right here. They're going to travel down through what's called the scalene muscles here. They're going to come underneath the clavicle here, also known as the collarbone, underneath the subclavius muscle and the pec muscle right here. Then those nerves are going to travel down through the interior of the arm here, and then they're going to come through and poke out of this muscle here, which is called pronator teres, which helps you rotate your wrist. Then it's going to come up here and it's going to innervate or give you sensation here. So what we want to do today is we want to identify where is it pinched and how can we treat it. So we're going to work our way up the nerve channel. We're going to work the pronator teres here. We're going to work the interior of the arm. We're going to work pecs, subclavius, scalenes. Then we're going to work the rotators of the neck. Then we're going to go into the alignment issue, which is the bones. So we're going to do an adjustment and we're going to do what's called a decompression maneuver. And that's where we're going to take the spine and pull it. Not aggressively like you see on some of the more popular channels, but simply enough to create some space there so that when the nerve is exiting that foraminal hole, there's enough space for the nerve not to be compressed. And then once we're done with all that, then we're going to do some passive therapies to kind of chill out the muscles and the bones, let everything rest. And we're going to finish with what's called traction. And it's a device that we're going to put on here that's just going to hold the neck in a stretched position to allow the discs to fill up with fresh fluid, blood, nutrients, and create space there for healthy nerve innervation. Now, when we're performing traction on the neck, we want to apply around 30 to 35 pounds of pressure, and then we want to help restore the 30-degree curved angle of the spine. So we're going to start by applying the pressure, then we're going to bend the neck back so that the back and the head are flush with the table, and there's a little gap here while also having pressure applied. Yeah, how do you feel?
Great.
Yeah?
So much better.
Excellent.
I
Thank you.
appreciate it.
All right. We'll see you next time.
Thank you.